Gallup and West Health have been tracking one specific question for 5 years running. Can American adults actually afford the healthcare they need? Not healthcare in general, but the visits and prescriptions they personally required in recent months. Their newest update, released this year, found that just 49% of American adults now qualify as what the researchers call cost secure, meaning they could pay for needed care without serious financial strain. That is the lowest share since the index began tracking this in 2021, when the number stood at 56%, and down from a peak of 61% in 2022. In plain terms, for the first time since this tracking started, most Americans no longer fall into the category of confidently able to afford their own healthcare. Before you assume this means the healthcare system is collapsing, or dismiss it as just another gloomy survey, let us sort the signal from the noise. Understand the methodology before the headline number. The West Health-Gallup Affordability Index does not simply ask people if healthcare feels expensive in the abstract, a question almost everyone would answer yes to. It classifies adults into specific categories based on their actual recent experience. Whether they paid for needed medical visits and prescriptions without cutting back on necessities, like food or utilities, to do it. Adults who consistently managed this are labeled cost secure. Those who struggled, delayed care, or went without are sorted into less secure categories, described in the research as cost insecure or cost desperate. This is a large-scale, recurring survey run by two established organizations, Gallup for the polling infrastructure and West Health for the healthcare policy analysis. And it has now been run consistently enough years in a row to show a real trend line, not just a single snapshot. The decline is not spread evenly across the population. The research found that people managing chronic conditions requiring frequent care or ongoing prescriptions saw some of the steepest drops in affordability, along with both younger and older adults compared to those in mid-career years. Sharp racial and ethnic gaps also showed up in the data, with only about 38% of Black adults and 32% of Hispanic adults classified as cost secure, compared to 55% of white adults in the same period. Women were also disproportionately affected, a trend the researchers connect partly to pandemic-era economic disruption combined with years of rising healthcare prices layered on top. Between 2024 and 2025 alone, an estimated 2.8 million additional Americans dropped out of the cost-secure category entirely, meaning this is not a slow multi-decade drift. It is an accelerating recent trend. This trend did not appear out of nowhere in one bad year. Healthcare prices, particularly insurance premiums, have been climbing faster than wages for several consecutive years, a gap that compounds over time rather than resetting. Reporting alongside the Affordability Index has separately documented that most Americans experienced higher health insurance premiums heading into this year, adding fresh pressure on top of an already strained baseline. Layer that onto broader cost of living increases in housing, food, and other essentials over the same stretch, and healthcare spending becomes one of the first categories families cut back on when a budget gets tight, even though skipping care or medication often costs more later. Researchers involved in the index describe this less as a sudden shock and more as a slow, steady erosion of financial cushion, the kind that eventually shows up as a majority of the country falling out of the secure category. Here is where the number needs context. 49% cost secure does not mean 51% of Americans cannot afford any healthcare at all. It means they fall short of the survey's specific bar for consistent, strain-free affordability, a meaningfully different and narrower claim. Some portion of that 51% are managing, just with real financial stress attached, rather than going entirely without care. This is also a self-reported survey, based on what respondents say about their own recent experience, not a direct audit of medical billing records, which is a reasonable and standard survey method but still carries the normal limits of self-reported data. And affordability figures like this can shift with short-term economic conditions. A strong year of wage growth or a policy change to insurance subsidies could move the number meaningfully in either direction. Treat this as a real, well-tracked warning sign, not a precise medical bankruptcy count. Quick recap. The West Health-Gallup Affordability Index found that just 49% of American adults are cost-secure. This year, the lowest share in the 5 years the index has existed, with chronic condition patients, Black and Hispanic adults, and women hit hardest, and 2.8 million people falling out of that category in the last year alone. So, signal or noise? Signal. This is a rigorous, multi-year tracked survey from established research organizations, and the downward trend is consistent and accelerating, not a one-time blip. Some noise creeps in only if you round 49% cost secure into 51% cannot afford any healthcare, which overstates what the specific methodology actually measured. The honest takeaway: healthcare affordability in America is genuinely getting worse for most people, and the data backing that claim is solid. Subscribe for the economic numbers that actually affect your wallet, checked against the real data. Signal from the noise. Every week.